Yeah, you need to talk on terms that the 90% can bloody register with their little raisins. Like in Simpsons, they showed Homer Simpson. I'm just talking jokes now. They showed he had a raisin instead of a brain. That was interesting.
God.
It was pulsating as well. That was okay. So howdy ho. Hello there. Hi. I'm Sandra DeRoy. I'm very grateful that Graham Downing is sitting here with me. And we just came after his, it was yesterday actually, your talk. But we're at the AV10 conference organized by Ian Crane, and it's at Milton Keynes. And it's my very pleasure to introduce you to Graham Downing, who's essentially concerned about humanity and talks about transhumanism, AI, artificial intelligence, and the sort of hazardous effects of 5G. And 5G interests me because it's actually directly affecting me as a UK settled civilian. I just had my settled status granted to me after 13 years. Thank you, United Kingdom. Pre-settled status. Okay.
Whatever that means.
I don't know what it means. But anyway, so I relocated from London, and that was the smartest move, probably. And I moved from a bunch of smart meters into a situation where I had a 5G street lamp placed in front of my house. And unfortunately, it's too close to my bedroom, just 10 meters. And it was placed there after me moving into the property. So it appeared 3 months after. And me knowing a little bit about EMF effects, then I kind of felt that something is going on in my living zone. I don't feel right, and I don't know, Graham. You know, that was my introductory. So maybe you can just lead the way.
Okay, so yeah, I mean the 5G thing, and as you know, I was just interviewed just prior to this. The guy that really is the expert on this is Mark. In that regard, okay, in terms of the physics of it, and he says it's a weapon system, and that's his area of expertise. I became interested in 5G, like many clinicians and many scientists, because there's been evidence, and many groups have brought evidence and shown that you can damage biological tissue with this technology. I'm just keeping it really conservative.
Yeah.
Okay, fine, great. So where's the safety testing before you roll it out across the globe? I mean, is it an unreasonable thing for some safety testing? And then I looked and realized, from my understanding, there wasn't any safety testing. And I couldn't understand this because I don't know of any technology on the planet that isn't anywhere near as impactful of what this is going to be, because this is going to be rolled out across the globe. That isn't safety tested. So it's just a simple, there shouldn't be any debate about this. There shouldn't be any, argument about this. This is very, very basic. If it's going to be safe, and studies at the moment show it's probably not going to be safe, it's going to be safe, safety test it and prove it. So, and there are many claims about it. I've looked into it, and they've done studies on this. There are people that are sensitive to this type of stuff. Usually they've got other things maybe going on or not. So, but the point is, look, there's no proper testing. So how can we prove one way or the other? And this is it. This is just basic common sense science. So that's my view on it. And really, it's not rocket science to say what I just said. It's pretty common sense.
Absolutely. I took initiative and I decided to experiment. So I have a EMF machine. It's a Norwegian company that produces it. I'll add the link below. And basically, I purchased the curtain from them, trying to solve this issue. and basically put the curtain in front, and then I got the machine and I measured it, and the noise with the curtain alleviated significantly by at least 70%.
Oh, wow, that's good.
Pull the curtain away, and the high pitch noise that comes without any coverage or protection, it's unbearable. You will see this footage is on my channel, and people are saying that this is like, what sort of evidence you need more? The evidence is there. The machine is playing the sound,
and that's where you sleep.
And that is 10 meters away from, I mean, even a 5-year-old would understand this, that if you put an electrical device, you know how we're brought up, they say switch off the electrics around you. I have a black box zapper with an antenna on it, 10 meters away from my bed on the same level, and I'm sleeping next to that zapper box. Am I going to get leukemia within the next 2 years? We don't know. Let's see. Let's find out.
Don't wait to see.
Okay.
That's a bit of an experiment too far. You don't want to do that experiment. But
Okay.
the thing is that when you work with patients, as I do work with patients, one of the things you do is you secure that the bedroom is safe for them to be in. It's not even an EMF thing. It's anything. Any allergies, any carpet. Because you need to sleep to restore your health. If you can't sleep properly, you're not going to be healthy. In fact, actually, I think there are some studies show that just on a basic kind of physiological level, that this kind of technology raises cortisol, which is a stress hormone. And if you raise cortisol, especially when you're trying to sleep, that's counterproductive because it blocks the kind of hormones like melatonin. It blocks these things that you need to rest and sleep. And then, so even without getting way out in the left field of this, just things like if you don't have melatonin, and you don't have the growth hormone released to actually repair you at night, then you're more prone to disease, you're more prone to things like cancer, and this is well established in the literature. So this is just basic physiology, basic stuff.
Melatonin decreases when there is even a slight light peeking into your bedroom, because your brain is, I don't know how to call it, but it needs to be pitch. It needs to be dark for you to rest. So I had an IT fella coming into my house helping me with a program, and I showed him this box. He's a skeptic. He didn't believe about the white noise issue that I was having, and he was like, okay, I'm not sure about the white noise, but there's a light on, for God's sake, next to you. A LED light on 10 meters away. You're not able to sleep with a light on next to you. So let's look at it even from that light melatonin aspect,
No, you're right. And the thing is, you have to have so just wear some, well, actually no, because it goes with the skull, so you do need complete blackout. So people do wear eye masks. If you can get one that actually covers the front of the skull, that will be helpful.
Really?
But, because, and
I need to get that one.
Yeah, and so, this is standard stuff. This isn't particularly clever stuff.
I didn't know through the frontal lobe, Graham.
Oh, yeah.
I did not know that.
Yeah, and also as an extension of that, we're talking in terms of this 5G and all this kind of antenna stuff, the EMF has been demonstrated that even at a distance, and I was talking to being interviewed earlier, they did experiments with animals. Because when you use a normal phone with Wi-Fi, you're meant to use it slightly off the ear, right, for safety. People don't, they whack it on the ear, and you're seeing all these, what we call ipsilateral tumours. You're seeing tumours on the side where they use the phone, and this is starting to be seen. So you're meant to hold it off the ear. That's when how the safety studies were done. Well, the non-existent safety studies with 5G, what they showed is they can be 40 centimeters away from the head of an animal, and you'll still get effects in the brain of the animal from this microwave technology. So this is
the science, the evidence is there. Okay, not good. It's not good. So what I did was, I moved into the guest room, other side of the wall. I'm happy I have that room now, and it's facing towards the garden, and actually it's good because I can sleep with my head towards north, because they say your head needs to be towards north when you're sleeping. And what's happening is the combination with the current now and the 1930s red brick house, the walls are solid, so it is blocking.
Oh, excellent.
So the white noise is still there, but it's not as bad, and I am finally able to sleep. And now the thing is that the question is that what is then the difference and which is worse? Is it the smart meters that I used to live next to in London in a converted apartment block? There were 15 smart meters.
Wow.
I was telling Mark Steele on each floor, and people were relocating from the building. The landlord said that